This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be talking about euthanasia for dogs and cats. Points to help you decide exactly what is it and what you can expect. Hi you guys, welcome again back to my channel. This is a little bit of a more serious video. I often get asked the question, should I be euthanizing my dog or cat? Is this a good time? Is there anything that you can say that can help me make that decision? What can I expect? So I thought it was important that I make a video of that, and I've, in truth, I probably avoided it. It is an uncomfortable subject, something in veterinary practice that I've done hundreds, more like probably thousands of times. It's not necessarily one of the more pleasant parts of the job. But that's something I'm grateful that, being a veterinarian, we have the ability to do that. So I thought it was important to make a video about euthanasia. I've got my own pets here in the background. I've got Lewis here, which you can see me petting, and just right up in there behind me is Gussie, who's asleep. In part, it's also a good video because I've got Gussie, who's the age of 20. She currently has end-stage kidney failure. She's now got a pretty serious secondary infection, so there's just quite the odor coming from her urine, and there's issues around her quality of life. So it's in part a good video for me to be making, and I think probably a good one you guys are going to get some helpful information out of. So first, you guys, what is euthanasia? Euthanasia is just a humane way to end an animal's life. Typically in veterinary practice, what it means is injecting a drug. It's called sodium pentobarbital. It at one point was a drug used for anesthesia. It's an older anesthetic drug, and then literally what it does is when you inject it, it stops your dog, your cat from breathing, so they go into a state of anesthesia, and as their breath stops, they're fully sedated under anesthetic. Then within a short period of time after that, their heart will stop. It's a very humane, gentle way to have an animal end their life. So what are some of the things to help you to decide, is this the right time or not? It's one of the more common questions I was asked in practice with our older pets. So some of the big things, initially, I really think it's important that we're looking at quality of life, not quantity of life. So assessing, does your dog, your cat, or do they still have a good quality of life? Gussie here, for instance, she's still eating, she's still drinking, she's relatively content. Yeah, she sleeps most of the time, probably over 20 hours a day. She still interacts with us, she still comes to visit, she still gets petted, she's still purring when she's petted, and she seems reasonably comfortable. Those are some real big things to be asking yourself. What is your dog or cat's quality of life? Are they still interacting with you? If they are they in any serious amounts of pain, and can that pain be adequately controlled? Do they have a terminal illness or not? Something we know is going to end their life. Those are all some really big questions to be asking yourself and to be asking, you sort of going through making that decision. And then the other things I found is, for instance, in terms of assessing that or not, is asking questions about yourself. Are you making this decision in terms of extend your dog or cat's life because you have real big issues with death? Or is it really in your dog or cat's best interest to keep them living? For the most part, I found most clients are pretty reasonable, they're pretty thoughtful, and you have a pretty good sense about when is the right time to make that decision or not. Some other points I think are important to bring up. Obviously, you need to be having this discussion with your veterinarian. Clearly, they go through this, often a number of times throughout the week. They've had years of experience in terms of making that decision. So talking with them about what is their, assessment of the quality of your pet's life. Are they in any serious amount of discomfort or pain? Talk to friends, talk to neighbors, other family members. Have this discussion. What is the right time or not? Because it's not something that you want to prolong your pet's life unnecessarily, nor do you want to make that decision in a rush too. So it's something to be really thought out. And in terms of going through that basic checklist around their quality of life. Lewis is an example. Yes, he's older. Yeah, he has a degree of arthritis. He can't hear anymore. But he's a pretty darn happy dog. He's still eating regularly, drinking regularly. He's still able to exercise. He's very much interactive with us as our family. He's quite happy to still greet other dogs. He's got a pretty darn good quality of life. And, you know, I would often talk about, for instance, with many of the dog owners, especially some of these labs, for instance, like Lewis, you know, a big indicator of being really seriously ill is their appetite. If they've still got a great appetite, it's a good indicator that they're still pretty happy, pretty content. Lewis has a great appetite, but I know if his appetite dramatically drops off, he starts to show no interest in food. There's something seriously wrong there. And secondary, if that prolongs and persists, as he's a bit older, I know, for instance, then the time is going to become very close. With Gussie here, for instance, her big thing is, yeah, she still is eating, she still is drinking, she's still interacting with us in terms of she's still seeking attention, she's getting affection, and she's pretty comfortable as far as, you know, my basic assessment in terms of her not being in pain, her basic underlying condition of having kidney failure. Yes, she's drinking more water, but she's getting primarily canned food. She's staying hydrated. You need to be able to assess those underlying things that could be going on with your dog or cat and making sure that they're not uncomfortable in any way, or at least that degree of discomfort can be managed. So if they are in pain, they're getting adequate pain control. So that's a real good assessment for me. I'm going to know with Gussie, for instance, and I suspect what's going to happen is that she's going to lose her appetite. She's going to get progressively dehydrated. Then it's going to be pretty obvious. I'm going to have this very anorexic, dehydrated, lethargic cat who's not interacting. And then the decision will be made. And then she'll be able to be comfortably euthanized. So euthanasia itself involves, and this is how I did it in veterinary practice, is we first had a big discussion with the client. We're really clear in terms of what we're doing, and we've made the correct decision. Secondly, I taught clients the steps of euthanasia. In terms of initially first, it's, you know, what I would do in practice is first sedate anyone's dog or cat first. So they're given an injection in the muscle or just under the skin. Take anywhere from 15 to 30 minutes before their dog is very calm and relaxed and sedated first. Generally some form of narcotic painkiller, such as hydromorphone, maybe in combination with a sedative, such as acepromazine, because I want your dog relaxed and comfortable. The next thing we would discuss, in some cases, we would put in an IV catheter to make it easy to give the final IV injection. I did many home euthanasias. And for a majority of those guys, that wasn't an option, and I didn't need to do it. The biggest thing was having the pets comfortable and sedated first. So they're giving that IM or sub-Q sedation first. And then the last injection comes in the form of the sodium pentobarbital. It's given IV. So for instance, in the dogs, it'd be an injection that's given in the front of their leg. That's the cephalic vein. If I was in practice, I would have an animal health technician there to roll the vein and hold it off. And then we do the injection. And as I said, it happens pretty quickly. So within the sort of 5 or 10 seconds, our dogs or cats would stop breathing, and then eventually their heart would stop beating. With the cats, they'd be given an injection into the back of their leg. Typically, this vein in the inside part of their thigh called the saphenous vein. And as I said, if it's done in that way, it's a very safe, painless way to be having your dog or cat humanely end their life. And unfortunately, or fortunately, you know, I've been able to do that in veterinary practice. I've seen hundreds of animals humanely euthanized, and yeah, I've even had to do it to my own pets. Hopefully you're not at that point to make that decision, and if you are, just know that it's a real humane way to end your dog or your cat's life. So thank you guys for watching this edition of Veterinary Secrets and euthanasia, you having a better understanding of what euthanasia is and some of the points to consider if you are considering euthanasia for your dog or cat.